I'm the director and owner. So yeah, I basically keep the lights on and try to put together the best team possible in order to facilitate the best care possible for our residents. Yeah, well Craig, I feel he's quite beloved by both the patients and the co-workers. Craig, I immediately could see when I met Craig that he is a very calm and patient individual, and I think further to that, he's non-judgmental, and that is the most important thing when dealing with the population down here, because there's a lot of opportunities to judge them, but if you can withhold judgment of them, they can sense it, they'll open up to you, they'll be more calm about you.
One of the biggest things was actually just putting the pharmacist and the patient face to face. So if you look around here, we don't have glass and metal bars between us. We don't put big barriers up. So that was one of the huge things. Patients come in here, you look around, you don't see the pills on the wall. It's not really about the pills, it's about face-to-face talking, finding drug therapy problems, and then resolving those problems for the patients. So that was one of the biggest changes I notice here. It's very pharmacists are really doing the clinical work, and we have registered technicians doing all the technical work for us.
Well, Craig is really the linchpin of the team, actually. He's the pharmacy manager and was the first person to sign on to this crazy venture when I had the idea of coming down into the downtown east side to try to help people in a new and innovative way. And so one of the things that we worked out was this idea of providing depot injections for the mental health component. I think historically there's been a lot of focus on the drug use in the area, but what Craig and I try to see is the resident as a person with a variety of challenges, and try to not look at the very obvious things such as the drug use or some of the volatile behavior that comes as a result.
Basically, it came from Bobby Milroy himself. I think he had done a lot of research with the doctors in the area, finding out what some of the needs were. This was one of the ones that was brought up by a psychiatrist that works closely in the downtown east side. Just mentioned, this could really help us out. There's a lot of people that are missing their appointments. They see their pharmacist every day, 7 days a week or once a week, but they miss their appointments here, and suddenly they're late for their monthly injection, or they're 2 weeks late for their injection, and they start to deteriorate. So the idea was that we're seeing them every day, we can kind of see how they're going, and we're just another easy access point. It's not going to stop doctors from doing their injections, it's just another access point. We sort of removed a barrier for them. I think it's more exciting for pharmacy than me personally feeling excited. It's a great feeling, it's great to have the award, but I think the award represents more about pharmacy pushing the boundaries, expanding the scope of our practice, which is what we need to do right now in pharmacy.